Hi Judy, thank you so much for being here with me today. I just wanted to ask you a couple questions and hear about your experience here at our office. So the first thing I'd like to ask you is, what initially brought you in here? What were you seeking help for?
Well, thanks, Julie, for this opportunity. From a traumatic brain injury in February of 2016, earlier this year, I fell on the ice, hit my head very hard, went unconscious, and had severe side effects from it. And so my daughter did a lot of research in the area, and she's the one who found Dr. Galliard for me.
Wonderful. And you have been utilizing our live oxygen therapy here at the office. You've also been going through neurofeedback therapy. Can you give us a little bit of insight of what you've been experiencing with that, if you've seen any changes at all?
I would say, Julie, it's been significant, the changes. Initially, I had a very hard time, light sensitivity to any fluorescent lights, walking, my balance, delayed speech at times from my thoughts to my words. And in starting the Life to Oxygen therapy has been significant. The neurofeedback has been, what do I want to say? It's more than I would have thought. For example, prior even to the injury, I had dyslexic symptoms. I would transpose numbers and letters. I'm not doing any of that. I don't need to wear my sunglasses all the time, indoors, outdoors naturally with the sun. My ability to remember, focus, I'm sleeping a lot better. I don't have nearly the head pain, the headaches. I can tell difference in my digestive system. So I would say there's been a lot of positive, and the support with Dr. Galliard, the staff here has just been amazing.
Wonderful. Well, thank you so much for sharing such a personal experience with us. And is there anything lastly that you'd like to say to anybody who's, seeing if there's any alternative options, people who are hurting, looking for treatment?
I would say, if there's ever been a concussion, a brain injury, even if it's 10 years ago, 15 years ago, I would recommend them having this therapy. If there's any PTSD, learning problems, handicaps that way, I would recommend this therapy. And as I've learned from the office here, the brain needs two things, glucose and oxygen, and that's has been a tremendous help in my recovery so far, and I look forward to continuing on with recovery here, even beyond just the brain injury.
Wonderful. Thank you so much for sharing your experience. I really appreciate all the valuable information you've given us.
Great. Thank you, too.